Hello everyone. After talking about the mandible and the frontal bone, today we are going to talk about a bone that has relations with both, the maxillary bone. The maxillary bone is an even bone that represents the floor of the orbit and of the nasal cavity and the roof of the mouth. The maxilla is a bone of the viscerocranium and relates to almost all the bones that are part of it, including the mandible, to which it joins during mouth closure. With the lacrimal bone via the lacrimal-maxillary suture that contributes to the formation of the lacrimal canaliculi, within which passes the nasolacrimal duct that transmits tears from the lacrimal gland, that we have seen is in the lacrimal fossa of the frontal bone, to the inferior meatus. With the frontal, forming the frontomaxillary suture between the nasal portion of the frontal and the frontal process of maxilla. With the zygomatic bone through the zygomaticomaxillary suture, forming the floor of the orbit, and which is the point of origin of the masseter muscle. With the ethmoid, either within the orbit or through two sutures within the nasal cavity, the ethmoidomaxillary sutures. With the nasal bones at the level of the nasomaxillary suture. With the palatine bone to form the floor of the nasal cavity and the roof of the orbit forming the posterior third of the hard palate, in the palatomaxillary suture. The nasal surface of the palatine process of the maxilla is articulated with the inferior border of the vomer to form the inferior portion of the nasal septum. With the other maxilla at the level of the intermaxillary suture, this union forms the anterior two-thirds of the hard palate. The maxilla helps to form the nasal septum, which is also formed by the vomer. The upper part of the septum is formed by the perpendicular lamina of the ethmoid, the nasal bones, and the frontal at the level of the glabella. Area covered by the septal nasal cartilage that relates superiorly to the nasal bones, posteriorly to the ethmoid and postero-inferiorly to the vomer. From this perspective, we also see the optic foramen, the superior orbital fissure, and the inferior orbital fissure, points of passage of important nerves that we will see at the end of this video. The maxillary bone consists of a body and four processes: the frontal, zygomatic, palatine, and alveolar processes. The outer face possesses in its lower edge, the dental alveoli, insertion points of the maxillary teeth, among which is the canine eminence. The zygomatic process of the maxilla, union of zygomatic and maxillary, is a pyramid-shaped structure that represents the floor of the orbit. Below it is the infraorbital foramen, the passage point of the infraorbital nerve, a branch of 5-2. The maxilla takes part in the constitution of the floor of the orbit with its orbital face. The anterior nasal spine is the point of attachment of the vomer, the frontal process of maxilla that articulates with the nasal part of the frontal bone via the frontomaxillary suture. The anterior face has the insertion of the buccinator muscle, orbicularis, the levator labii superioris and levator angulae oris, and the myrtiformis muscle. In the medial and posterior faces, we can see how the maxillary bone has 3 points of union with the palatine. From this view, we can see 2 of them. The union between the maxillary and the orbital process of the palatine, in close proximity to the orbital face of the maxillary, and the point between the maxillary and the pyramidal apophysis of the palatine. Important muscles such as the buccinator, internal pterygoid, and external pterygoid also insert here. In the inner face, we distinguish an upper or nasal and lower or buccal portion divided by the palatine process of the maxilla. This process has a horizontal and a vertical portion. The horizontal part represents the anterior two-thirds of the hard palate, at the end of which the palatine is joined to form the posterior third of the hard palate. The joint formed between the maxillary and the palatine is the third point of union of these bones. The vertical portion presents the anterior nasal spine. The vertical and horizontal portions of the palatine process of the maxilla are divided by the incisive canal, also known as the nasopalatine canal, a point of passage of the nasopalatine nerves, a branch of 5-2. Superior to the palatine process is the maxillary sinus, lined with ciliated cells and mucosa. Superior to the maxillary sinus are the ethmoidal cells, the junction point between the maxillary and ethmoid. In fact, the maxillary sinus, like all other air sinuses, drains into the ethmoid. Particularly the maxillary sinus drains into the middle meatus of the ethmoid. We will study its anatomy in a video on the paranasal sinuses. Anterior to the maxillary sinus is the junction between the maxillary bone and the lacrimal bone. Together they form the lacrimal groove, a deep groove in front of the opening of the maxillary sinus which takes part in the formation of the nasolacrimal canal. It opens into the inferior meatus of the nose and transmit the nasolacrimal duct. Above this is the frontal process of the maxilla, the posterior border of which forms the lacrimal canal, the anterior border that joins the maxilla to the nasal bones in the maxillary nasal suture, and the medial border which has the ethmoidal crest, the point of union with the middle nasal conchus of the ethmoid, and the inferior terminal crest that joins the inferior nasal conchus, which is an independent bone forming the inferior meatus, the point of drainage of the lacrimal gland. The lower face of the maxilla allows the hard palate to be seen in its entirety, with the maxilla forming the anterior 2/3, and the palatine the posterior third. Their union forms 3 sutures: the intermaxillary suture between the 2 maxillaries, the interpalatine suture between the 2 palatines, and the palato-maxillary suture bilaterally. The union of these 3 sutures takes the shape of a cross and is therefore called cruciform suture. Anteriorly, the incisive suture is not present in the adult. It is present until 12 years of age. The foramen present is called the incisive foramen, the oral opening of the nasopalatine canal. It transmits the greater palatine artery and vein and the nasopalatine nerve that runs to the anterior maxillary teeth and the anterior part of the hard palate. Posteriorly are the greater palatine foramen, where the greater palatine nerve that innervates the hard palate and maxillary molars passes through, and the lesser palatine foramina, points of passage of the lesser palatine nerves that innervate the soft palate and palatine tonsils. The maxillary takes part in the constitution of the pterygopalatine fossa, thus formed by the pterygoid process of the sphenoid, palatine, and posterior part of the maxilla and site of the spheno or pterygopalatine ganglion, which receives preganglionic information from the vidian nerve. The superficial greater petrosal nerve, consisting of preganglionic parasympathetic fibers from the facial nerve, passes into the foramen lacerum, where it joins the deep petrosal nerve, which carries sympathetic fibers originating from the superior cervical ganglion to form the vidian nerve. The vidian nerve enters the posterior region of the pterygopalatine fossa to join the pterygopalatine ganglion. Postganglionic parasympathetic fibers enter the maxillary nerve through its ganglionic branches. The maxillary nerve originates from the trigeminal or Gasser's ganglion, which, as we saw in the video on the temporalis, is located in Meckel's cave near the petrous rock of the temporal bone, while the ophthalmic branch of the trigeminal nerve enters the superior orbital fissure and the mandibular branch enters the foramen ovale. The maxillary branch runs into the foramen rotundum and enters the pterygopalatine fossa. Here the maxillary nerve divides into the zygomatic nerve, which will pass into the inferior orbital fissure and gives branches that will innervate the skin of the temporozygomatic region, and joining or not joining with the lacrimal nerve will innervate the lacrimal gland. The infraorbital nerve is the direct continuation of the maxillary nerve and forms the superior alveolar nerve, which with its branches provides sensory innervation to the cheeks, maxillary sinus, gingivae, and maxillary teeth. Coming out of the infraorbital foramen, it divides into 4 branches that provide sensory innervation to the skin of the eyelid, nose, cheek, and upper lip. From the pterygopalatine ganglion originate the palatine nerves, greater and lesser, which, as we mentioned earlier, lead, after passing through the respective greater and lesser palatine foramina, to the hard palate, soft palate, and palatine tonsils, and the nasopalatine nerves, which exit the nasal cavity through the incisive foramen and innervate the hard palate, gingiva, canine teeth, and sometimes the incisors and the postero-inferior part of the nasal septum. The pharyngeal nerve is a small branch that originates from the posterior part of the pterygopalatine ganglion. It passes through the palatovaginal canal with the pharyngeal branch of the maxillary artery and distributes to the mucosa of the nasal part of the pharynx, behind the auditory tube. The maxillary nerve is an exclusively sensory nerve supplying the region below the orbits, hard and soft palate mucosa, nose, skin of temple, mucosa of the maxillary sinus, and part of the nasal septum. The nerve, with its axonal fibers, also serves as a pathway for the sympathetic and parasympathetic postganglionic fibers of the pterygopalatine ganglion. The pterygopalatine ganglion comprises parasympathetic, sympathetic, and somatosensory nerve fibers. Here 2 short ganglionic nerves serve as communicating bridges between the ganglion and the maxillary nerve. The sensory root comprises of general somatic sensory neurons which transmit general sensations from the face, oral cavity, tonsils, nasal mucosa, pharynx, and orbital periosteum. These sensory neurons reach out to the pterygopalatine ganglion via the palatine, the nasopalatine, the orbital, and the pharyngeal nerves that traverse unrelayed through the ganglion to intermaxillary nerve via the ganglionic branches and end up synapsing inside the Gasserian ganglion. The parasympathetic root of pterygopalatine ganglion comprises of preganglionic parasympathetic fibers which travel through the greater petrosal nerve, while parasympathetic preganglionic neurons traveling through the greater petrosal nerve make synapses with postganglionic cell bodies within the ganglion. Sympathetic postganglionic neurons arriving from the internal carotid plexus through the deep petrosal nerve pass through the pterygopalatine ganglion without making synapses. Like the sensory root, both nerve fibers then travel through the maxillary and ophthalmic divisions of the trigeminal nerve to provide secretomotor signals to the lacrimal gland, mucous membranes of the nasal cavity, nasopharynx, oropharynx, upper buccal cavity, and some meningeal and cerebral blood vessels. Branches of the internal maxillary artery, a branch of the external carotid artery, provide collateral branches, such as the posterior superior alveolar artery, which heads to the roots of the upper molar and premolar teeth and the maxillary sinus. From this view, we can also see the ophthalmic artery, a branch of the internal carotid artery that divides into the ethmoidal arteries, the frontal or supratrochlear artery, and the dorsal nasal artery, one of its terminal branches, runs along the nose to anastomose with the lateral nasal branch of the angular artery, the latter also a terminal branch but of the facial artery. The infraorbital foramen transmits the infraorbital artery and vein and the infraorbital nerve. Summarizing, from the anterior view, we can see the frontal process, the anterior nasal spine, the infraorbital foramen, and the lacrimal groove. From this medial perspective, we can see again the frontal process, the maxillary sinus, the ethmoidal cells, the incisive canal, the two parts of the palatine process, and the lacrimal groove. From a posterior view, the palatine process again, and 2 points of union of the maxilla with the palatine bone. From a lateral view, the anterior nasal spine, the infraorbital foramen, the orbital face of the maxilla, and the zygomatic process. From the view from below, the intermaxillary and palatomaxillary sutures, and a part of the incisive foramen. With this we have concluded. I leave you here some videos of topics related to what we covered today. Until next time.